I'm Ron Peterson, President and CEO of Baxter Health, and we're so glad you're here today. And I think as I look around the room, I know most of you, but wanted to make sure that you know who I am. And we're so glad you came, so glad that you're here. And I'm looking around the room. It looks like we've got a few people who are relatively new. I don't know how many last 2 or 3 years at orientation we've been showing a video. And it's the first thing we show, and it shows basically all the different people and all the different departments in the hospital. But it's entitled something like "Every Person Makes a Difference at Baxter Health." And I think that is so true. And we're going to talk about what we've accomplished this past year, but we've only accomplished it because of you. And every person makes a difference. And you might say, well, I didn't have anything to do with that. Well, if you helped with basically provide patient care, if you helped a caregiver, if you helped keep the hospital clean, if you helped escort somebody to where they wanted to go because they were lost, you made a difference. And so we appreciate so much what you do for Baxter Health. And we're just excited to share all the different things that we have. And, if I could remember where I left everything, like the little clicker, I'd move on to the next slide. But we believe that because of you, we can champion access to compassionate, high-quality care. And that's our purpose statement, and that's very important because people choose to live, I believe, in the Twin Lakes area. A lot of people move in here, a lot of people move here. And if they have to choose, do I want to live here or do I want to live somewhere where I can get access to high-quality care, that would not make this area as attractive, would it? And you shouldn't have to choose that. You should be able to live where you want to live and have access to high-quality patient care. And that's why we're here to champion that, and we are here to provide that. And we believe the best way to do that is by 3 things. What are they? Can you read the slide? By remaining independent, okay? By remaining strategically comprehensive. We're not a UAMS, we're not going to do transplants, we're not going to have a burn unit, but for a community of 15,000 people, would you all agree we're pretty comprehensive, have pretty comprehensive services? Okay. And we want to stay community focused, because if we're not meeting the needs of the community, there's really no need for us to be here, is there? So, all right, so everybody, what is this a picture of? Baxter Health? All right, partially right. That's what we all think about, is that's Baxter Health. And that's true, but that's our main campus. Baxter Health is actually in 12 different counties, over 45 different locations now. So when you think of just the campus here, that's the majority, that's a big part of Baxter Health, but we do have over 45 different locations in 12 different counties. It's just an interesting kind of fun fact, but if you look at that the blue there, that's the 12 counties we serve. That's like 8,170 square miles. The state of Connecticut is 5,640 or something like that miles. So it's actually a larger area than the state of Connecticut, if you can believe that we're serving. The big difference is Connecticut has 3.6 million people in it. We have 230,000 people. So very rural area that we serve, as all of you know, but that's the area that we serve, and we want to be the market share leader in every county that we serve. And why would we want to do that?
We can help out more people.
Exactly. So then we can meet our purpose of championing access to compassionate, high-quality care. That's exactly right. And so we are halfway there. We set that goal this year. We set it out as a 5-year goal, and we started looking where we're at, and you can see the 6 counties where we are the market share leader, but we have 6 counties to try to gain more market share, and that will help us grow, and that'll help us continue to survive as an organization. So that is definitely our goal. These are just some numbers to tell you what we did last year, and you'll hear about some of them here in the future too, but you can see we did about 34,000 ER visits. We did, give or take, about 10,500 surgical procedures. And I was just talking to Raul right before, and he was telling me we did 177 open hearts, which, yeah, that is incredible. So we're really excited about that. We have 2,326 plus individuals in our organization now, or within our family. That's how large we've grown. That's, I think, incredible. And some of you probably, this number may not mean much to you, but just to keep our doors open cost us $841,000 a day. And that's 365 days a year, not just 5 days a week. Just want to clarify that. Okay. All right. Is anybody awake? Yes? Okay. It's just, my wife is right. I'm the only one who thinks I'm funny. Is that right? She tells me that all the time. So she's probably accurate. All right. Well, we want to talk about some things that we've accomplished, and we've kind of heard we have a relatively new senior leadership team. We've had a lot of retirements in the last 3-4 years. And so we want to make sure that you know our whole senior leadership team. And yet we want to talk about our accomplishments because you all were part of it. So I can tell I'd put you to sleep if I said them all. So I'm going to have our senior leadership share in what some of these accomplishments are. I'm going to start with Brian Barnett. Brian has been with the organization about 13 years. He left for a year or two and went to the VA, but then we were very fortunate. He came back, and he's worked in several different roles, but the last 2 years, or almost 2 years, he's been on our senior leadership team and vice president of Physician Enterprise. So Brian oversees all of our clinics and all our business development, and he's going to talk about a few accomplishments that we have here. So Brian?
Thank you, Ron. We just wanted to celebrate you guys today. I mean, ultimately, we couldn't meet any of these goals without you. And sorry, they're telling me to hold it closer to my mouth. So, well, anyways, we just want to celebrate you all today. I mean, like I just said, we couldn't do any of this without you. This isn't our achievements. This is your achievement. So we just appreciate what you guys do here every day. But we did add 18 new physicians. Kaylin Hannaford, you'll just wave at us, please. She is our physician recruiter, and she did a tremendous job last year. It's actually an all-time record. 6 of those physicians were in a heart and vascular program. So in cardiology, we added Dr. Bowen and Dr. Zaid. In vascular surgery, we added Dr. Arita and Dr. Broussard. And then in CT surgery, we added Dr. Bauer and Dr. Ostro. So, and special thanks to Raul sitting in the front row up here. If it wasn't for him, we probably wouldn't have any of those. So that's one of the things they talk about is when they see he and his team work, when they're here for their visits, it helps us get them. So we appreciate that very much. Sarah and her team in the foundation raised over $2.9 million, which is just incredible. So anytime you see a piece of technology or a robot or anything new or us remodeling rooms, it typically comes from the foundation and our community supporting us. Ryan in the pharmacy launched a Meds to Bed program. And so what that allows our patients to do is get their medications on discharge before they leave the hospital. So they're not having to go and battle with the pharmacy to try to get their pain medicine or whatever that may be. So really improving patient care. And then Brandon Ellison and Rob Rogers and their team with the construction, they finished out 3 ORs. So 2 at the outpatient surgery center and 1 in the main OR. And really that's while doing multiple other projects, but also the ER remodel too. So they did a tremendous job for us. So we just appreciate you all. And again, we couldn't do it without you.
The next person up is Sarah Edwards. She has been with the hospital about 9 years. Sarah has worked as the executive director of the foundation for just a little over 2 years and been on our senior leadership team for those 2 years. And Sarah's going to talk about 5 more accomplishments that we highlighted.
Yes, thank you, Ron, and thank you all for coming and hearing about all that you helped us accomplish in 2024. So we could not have added 6 new clinics into our service area without many departments' help. IT, telecommunications, HR for hiring, all of the folks that help us grow our service area. So added 6 new clinics into our Baxter Health family. Over 400 volunteers last year gave their time, and that equated to 56,000 hours of time. And that is the most in the state of Arkansas out of all the hospitals with auxiliaries. And they do that because of you. They want to be a small part of this Baxter Health family. So thank you for allowing them to do that and come in and help you all every day. We also improved our clinic AR days to 33. That means accounts receivable. What that means is that whenever an invoice is sent out, a bill is sent out, it took about 33 days to come back so we could get paid. So that is an incredible feat by the team, Victoria's team in the rev cycle. And then our marketing team. Did anyone see the recruitment video last year where one of our physicians jumped off of a cliff? Work where you vacation. Well, it won a great award last year at the Arkansas Hospital Association award ceremony. So kudos to our marketing team and all that they achieved last year in showing what you all get to do every single day, which is provide care in a beautiful area. And then last but not least on my portion, our white coat program. If you don't know what that is, it is our program that we have an association with the high schoolers who are interested in possible healthcare opportunities in the future. We bring them in, they use our simulation lab and learn through hands-on training through that program. We were able to start it with Mountain Home, and then in 2024, we were able to add Cotter and Norfolk schools. So we want to include as many schools in our service area, and in 2025, we're already adding more schools to that program. So thank you all so much again for allowing us to do all that we were able to do in 2024.
All right, great. And if you haven't seen that recruitment video, go to YouTube and you'll see it. It's worth 3 minutes, okay? So next up is Rachel Gilbert. She's our Chief Nursing Officer. She has been our Chief Nursing Officer, I think in April, it'll be 2 years. And Rachel's been with the organization 20 years, so most of you probably know Rachel. But Rachel's going to talk about the next 5 accomplishments that we have.
Okay, so one of the really exciting things that we brought on for last year was the new Island Robotic One bronchoscopy. This allows Dr. Malty to go in and capture biopsies, and we can detect cancer more precise. So the RT team surgery is taking a lot of people in this clinic and a lot of people to get this up and going, and we've seen a lot of success with this so far. We have seen a record volume in 18 different areas across the hospital. I'm sure most of you have felt that over last year, our growth, and Tobias will continue with some information on that. And then we reduced Fulton County AR days to 42 days. Debbie, what were we to start?
194.
194. So that was a significant decrease, which helps us significantly. So, and then we transitioned Fulton County Hospital to Baxter Health, which has taken a lot of people in a lot of different departments, and Debbie, Anthony, and multiple people across the hospital and Baxter that have worked really hard to get Fulton County part of our system. And then we reduced hospital-acquired infections by 25%. Our goal for 2024 was to reduce them by 10%, and we reduced them by 25%, which is a very, very great, very significant. So very proud of all these accomplishments. And
What a great accomplishment to reduce the hospital-acquired infections and, reducing that accounts receivable from basically 200 down to 42. Obviously, as anybody from Fulton County would even say, you can't survive if you have 200 days in accounts receivable, which obviously is very true. So anyways, I'm going to have Anthony Reed. No, I'm sorry. I'm getting mixed up in my order. I'm going to have Tobias Pugsley speak next, and he's going to do a couple of slides because one of our senior leadership team members is actually out today. That's Nicole Vaccarella. She's been here 25 years, so I think most of you know, a lot of you know Nicole. She's our general counsel, and she is out, so Tobias is going to take 2 slides. And Tobias Pugsley has been with us about 9 years, and he's been our vice president of marketing and strategic planning for the last 2 years. And Tobias, we'll let you talk about a few accomplishments here.
Thank you, Ron. Hopefully everybody's learned something about our senior leadership team today, and that's that they do not like microphones. But first off, I want to start with the gross revenue volume. I think we all felt the growth last year, didn't we? Whether you were in security or EVS or by the bedside, we all felt that last year. 9.1% growth. Let's give ourselves a bigger round of applause for 9.1% growth. Show me another health system in America right now that's growing at 9.1% growth in these times. And that's because of the hard work of every one of you day in and day out. We also got the new Corey last year that's improved some outcomes for a robotic knee procedure. We've seen a record number of Heroes for Halos. Hopefully you've seen that as we come around the departments. It's always a good time recognizing all the hard work of everybody out there. And then as Ron mentioned earlier, surgical cases were at an all-time record, and our patient experience team everybody participates in patient experience in some facet, but one of the ways we measure that is with our patient scores. And last year, we increased 7 out of the 9 dimensions. And again, we're growing and our patient experience is getting better. That's incredible. Also, our Service Council hosted our first employee picnic. How good did it feel to get back in person after COVID and do events and be able to get back, seeing each other, having a good time, cutting up? That's what we all love to do. We love to work, but we love to play, and it was good to be back together in an environment we could have a little fun. We also had a 1.8% operating margin in 2024. Let me tell you something amazing. That's the first positive operating margin that we've had since 2019 that did not include COVID money. Isn't that incredible? We also now are scheduling MRIs on Saturdays. A big shout out to Shanette and the radiology team. That's something that thinking outside of the box, they came and they said, hey, we've got a backlog of MRIs. Is there something that we can do? Can we offer that on Saturdays? And they were able to move some things around and offer that service on Saturdays. Isn't that incredible? And then lastly, we also installed a new cysto table in OR8. And then for the 7th year in a row, we've now received the Medicaid Inpatient Quality Award. So excellent job.
All right, thanks, Tobias. And we're going to have Anthony continue with some of our accomplishments. And Anthony Reed has been with the organization pretty close to 17 years, just a little bit over 17 years. But he started working as the Vice President of Ancillary Services about 3 years ago. And so, Anthony, with that, we'll let you talk about a few more accomplishments.
Appreciate it, Ron. And like the other senior leaders have been saying, we appreciate you guys so much and everything you do here. Is this working? Yes. Okay. You're myself. None of these accomplishments would be possible without you, the sacrifices and time you make. So really just want to thank everybody for that. So last year, we performed a comprehensive security assessment, not only of the hospital, but all of our clinics as well. We had consultants come in, evaluated and assessed everything, and gave us just a book of recommendations. We formed a task force that is going through these recommendations, and hopefully you're seeing some of the results from that for better or improved access control at night throughout the hospital, better lighting in parking lots and other places, and a lot more to come on that. Partnering with ASU, we were awarded a $625,000 Align grant. And what that does is basically ensures we have a pipeline of nurses. So we're partnering with ASU to make sure we have nurses coming in the future here in the organization. Record volumes in Harrison and West Plains pain. Anybody from the pain clinic here? Somebody? They're
We'll
probably
see you, buddy.
working on those record volumes, I'm sure, right now. And something that makes me very proud, not only as an administrator, but as a nurse, is we submitted for our redesignation for Magnet. So hopefully everybody knows what Magnet is and how impressive and how important that is. And then we also implemented a new UKG Pro Payroll system. Hopefully everybody has that app on their phone, makes it a little more easy to find information about your benefits, pay, everything else. And again, just want to thank everybody for all the hard work last year and moving forward.
Great. How many people have used that app? Oh, good. Good. Is it helpful? Yeah, it is. It's nice and convenient. A lot of work went into not necessarily the app, but that whole conversion and making sure that everybody's pay was accurate and correct. And I think we're still working on it a little bit. So anyways, the next person up is Natalie Amato. And Natalie has been our Vice President of Human Resources about a year and a half, give or take. She started a year ago, October, in that role. But she's been with the organization, did you tell me, about 10 years. Yeah, about 10 years. So Natalie, tell us about some more accomplishments.
Okay, so well, it's good to see all of you here this morning. I wanted to obviously share a few more accomplishments for the Baxter Health team. So that first one, averaged less than 12 travelers. That is a huge accomplishment. So when the American Hospital Association, when they look across all the hospitals in the nation that have travelers, they looked at that 33% of them had a lot of their nurse travel hours coming from travelers. And it was like a huge amount. And so the fact that we only had 12 travelers that we averaged last year is amazing. And some of those were not even nurse travelers. Some of them were therapy. We had some surge techs in there. So again, our goal is to always try to keep that travel number very low. Imaging surpassed over 100,000 images. So do we have anyone in here from imaging, radiology services, or our clinics? Wonderful job on that. Great accomplishment there. The foundation had a generous donor, and they gave away over 650 Read to Me books to newborns. So that was a wonderful donation, as well as when I see that number, I think, wow, that's a lot of babies that were born in the hospital last year. So, you know, I know that our Women's and Newborn Care Center, their staff there, they work incredibly hard. And so just want to give a shout out to them as well. The emergency department, the complete remodel, so many staff were involved in that. So I know from Brandon Ellison and his team, engineering, construction, the entire ED department, our security, everyone that's involved to make sure that remodel goes successful. Last week, I saw some pictures of the ED and endo furniture that arrived. It looked really, really nice. So if you haven't been down there to check that out, be sure to check that out this week. And then employee concierge, Debbie Woods. I don't know if she's in this.
She's here.
Session. Debbie, just kind of put your hand up there. I want to brag on her a little bit. She has done a fabulous job in her new role, and she has brought some new services to concierge. We now have window tinting things to her. We brought back laundry. And then she also has added a ton of employee discounts. So big shout out to Debbie, and she's done a fabulous job. And again, that is there to support all of you employees and want you to have a better work-life balance here at Baxter. So thank you for everything that you do.
Great, thanks, Natalie. How many people have used concierge service? Oh, quite a few. Great. Is it helpful? Good, good. Yeah, it is for me too. I've used it quite a bit. All right, we're going to finish off our accomplishments. So last but not least, we have Debbie Henry. She's our Chief Financial Officer. She's been part of the senior leadership team since she came to us about 8 years ago, give or take. And Debbie, why don't you tell us about the last ones that we're going to highlight?
Wonderful. So the very first one, 1.26 million of insurance denials were overturned, and we were allowed to earn that money back second time. And that is actually cash that the insurance companies would have paid us. That's not gross charges. So we have several teams. The revenue cycle team, continuity of care works very, very hard. And actually, all the way from the very beginning of the charges. So anybody that's involved in that has a part in actually getting those funds returned to us. The second largest women in philanthropy contributions in Baxter Health history. Sarah brought this group of women together, and it continues to grow. And we're really looking forward to that this year. Reduced readmissions by 10%. We have worked on this goal for many, many years, and will continue to work on it to ensure our patients are cared for, and also that they don't have to return to us. This, many, many people in the organization works on this goal every year. And the last couple of years, we've really seen it extend beyond the four walls of the hospital and reach out into the clinics. And so they are playing a big role as well today with their population health efforts. Community health fairs, both in Mountain Home and Harrison, Arkansas. How many have attended those? It's absolutely amazing. You almost get run over. So if you haven't been, I really encourage you to step out and go to those each year. We have a lot of leaders in our organization that supports both of those, and it's our way of connecting with our community. And then finally, we implemented the clinical database program, and it took approximately a year just to build the program out, the software program. And that program has allowed us to do a couple different things, but basically we're striving to be able to capture the true picture of our patients and how sick our patients are and document that. And that has to be done so you can get paid appropriately. And also, as different organizations look at the risk, like mortality risk, it allows us to capture how sick the patients are, and our outcomes are recorded in a more accurate method. So Tammy Pica's team, Wendy Platt and her team, both are worked very hard on leading this effort, but it is reaching across the whole organization as far as provider documentation and even nurse documentation really impacts the outcome. And for example, from a financial perspective, we grew from 2023 to 2024. And for inpatient services, the average reimbursement for each of those patients increased over $600. And so when you look at the number of inpatients that we have, that's a significant increase. So just appreciate everybody's help.
Great. Thank you, Debbie. Appreciate that. All right. I think that was such a good year, and I think all of you helped with that you all need to first stand up. Stand up. I'm going to get a little energy out of you, whether you like it or not, okay? All right, now, cheer, clap, yell, whatever you got to do, but give yourself a round of applause. All right, now you can sit down. That's what I like. That's great. Thank you. Okay, so what are we going to do in 2025? Well, we grew 9.1% last year. So if you're not growing, what are you doing? Shrinking, dying, whatever. Right, so we have a goal to grow by 5.5% overall in our volume. We also have a goal of trying to make sure that we keep the employees that we have. We really feel that we're blessed to have such good people here. And so we want to try to keep our turnover rate at below 19%, which 19% might sound like a lot, but that's definitely below the national average. And actually, I think this year we were at 17.7%. So it should be an attainable target. Our ER, as was mentioned, is finishing construction. Hopefully in the next couple of weeks, it'll be completely done. Can you imagine doing construction and servicing patients, helping patients at the same time? That was quite a feat from both the caregivers and the people working in construction. But anyways, we've made some changes in there so that we'll be able to be geriatric friendly physically. And now we're also going to make some changes in the policies and the way we treat geriatric patients. And so we're going after a geriatric certification for our emergency department. And what is this community known for? Geriatric retirement, geriatric, exactly. And so that's why we want to make sure that we're keeping that community focus. We're also going to try to get a HCAP rating of 76%. What does that mean to anybody? Got a lot of looks on people's faces like, what? HCAPS is basically the patient satisfaction or patient experience survey. And this year we hit 73.6%, which when comparing to other hospitals, that's very favorable. But we want to continue to move up on that ranking. And so we're trying to get up to 76%. So think about growing at 9% and yet keeping patients extremely satisfied. That's what we're trying to do. The other thing was in the questions that you could ask beforehand, a question came through, are we going to build an ambulatory surgery center? Well, this slide is an actual picture of the building. So the answer is yes. It's an ambulatory surgery center over in Harrison. If you haven't been over there, if you drive through and you go past Neighbors Mill, go past Sonic, it's right to on the left side of the road there, right past Sonic, going north. And that building should be turned over to us sometime in April. The clinic will open in May. The imaging center should open in May. And the ambulatory surgery center, because you have to get certifications and stuff, it'll probably take till June before that's actually operating fully, but it should be operational by then. We want to obtain a 2% operating margin. If we're a not-for-profit hospital, you heard we made 1.8% last year. Why do we have to make a profit?
We can stay open.
So we can stay open, exactly. All our money being not-for-profit, all our money that we make, instead of going out to shareholders, gets reinvested back into the organization. So we build new buildings, we buy new equipment, we give raises, whatever, it goes back into the organization. So that's why we have to make money to be able to go. Our long-term goal is actually to get a 3% operating margin, but next year we're trying for 2%. We want to exceed 95 days of cash on hand. That's very important. We have bonds that we have on this building, and the best way I can explain a bond in a quick way is it's like a mortgage on your house, and the only difference is people rate your bonds, and in order to keep our bond rating so that we keep our interest rates low and so that we can continue to borrow money to build, we have to keep our days of cash on hand at a high level, and 95 would be a good level. Next year, because of our new emphasis on hearts, we are going to build a new cath lab. They'll be up on the second floor, and we're excited. I think construction will be starting on that, I would say, in the next month, in February sometime, and hopefully it'll be complete by August. So we're kind of very excited about that. They'll give us a total of 3 cath labs and 1 hybrid room, and vascular surgeons, cardiologist, radiologist. Anybody else that utilize the cath lab? That's about it. Yeah, they all utilize it, so it gets busier every day. So with that, I would like to thank you, because you all are the ones that make Baxter Health and make our reputation, continuing to keep it going, continuing to provide access and champion that access to compassionate, high-quality care. And the most important thing that you do, I believe, is Baxter is really known as the hospital that cares as much about people as for people. And I think through our magnet designation, we show that we provide high-quality clinical care. But I really believe we all get into healthcare because we want to help people. But then we get so busy wearing a mask, looking at our computer screen, looking at our telephone, whatever it is, thinking about the next meeting we're going to, that we sometimes forget to show people that we really do care about them, even though we're providing the same high quality clinical care. And so it really makes a difference. And I believe that's what we're known for. And so I want to thank you, is to be able to show patients' families, take that extra 30, 60 seconds, build that quick relationship with them, help them to their next spot, escorting them to where they need to go, helping them out, because when you're worried about your health, you're basically in a crisis mode. And little things like that can make such a big difference. So thank you all for doing that. I appreciate it. Got 2 more things before we go. One is I have some questions that came in beforehand, and then I'll actually be happy to answer any questions too. And then what's going to keep you here is not the questions. What's going to keep you here is after the questions, we have the door prizes. So Tobias will help us with door prizes. Okay, there are 4 questions. First one, are there any benefit improvements planned, like additional PTO or health insurance? And currently, we look at our benefits. We feel we're very competitive with our benefits. We spend, give or take, but pretty close. I think actually it's a little bit over $16 million a year on benefits. And right at the moment, we don't have anything planned, but we continue to look at them, and hopefully we might be able to provide some additional benefits in the future. But like I said, we don't have anything planned or anything that I could announce at this point in time. The second question is it possible to have the shuttle run in the parking lot behind the outpatient surgery center and the education building? And I talked with Brandon, and I think as of this morning, it has started to go back there. I think it used to go there, then it kind of stopped going there, but it will be running there now from now on. So shuttle service should be able to attain shuttle service in that parking lot. Third question was, when can we anticipate the next pay increase? That's what everybody wants to ask, right? So it didn't surprise me to see it. Last hospital-wide pay increase was in June of last year. What we try to do is give a few months of the beginning of the new year, which is January, February, March, see where we're at and see how early we can give those. Hopefully this year we can give them even earlier, but we'll be evaluating that in April and making that determination as far as when we can give them and what we can give, kind of based on how our volume and how we're doing financially those first 3 months. And the fourth question was, it's kind of twofold, but are you still pursuing an ASC in Harrison? The answer is yes, if you saw the picture, which isn't up there anymore, but saw the picture. And then, are we acquiring the hospital in Harrison? And no, we really haven't had any conversations with the Harrison Hospital. We really haven't had any thought process of trying to acquire that hospital. Our strategy in Harrison has been, we definitely want to be the market share leader in Boone County, but we believe that it's a lot of specialty care that goes out and primary care and more outpatient services. And so as we looked at that, we have right now, I think, 16 different providers in the Harrison market. If you talk to people on the floors in radiology in the ER, there's definitely more people from Boone County that come through now. Mark, do you see that in triage? Yeah. And that's what we want. We want them coming here for their care. But like I said, we have 16 providers in 6 different locations. And then the 7th location, we believe we'll be opening up another clinic in Harrison this year. And then we'll be opening up the ambulatory surgery center. So we'll have 8 different locations before the end of the year in Harrison. So, all right. Anybody else have any questions? Yes.
My son has to see a GI doctor, and so we got to drive 3 hours away to go see them. Is there any possibility that we could get one closer?
I would love to. I've been here to be 18 years in June, and when I came, I don't know how many of you remember Dr. McKercher. He passed away this year. He's just a great man. He was a GI doctor. He told me when I came, he said, Ron, start recruiting for a GI doctor because I'm going to be retiring soon. Well, believe it or not, we've been recruiting all 17 years. They're just really hard to find. We were that close to signing one, wherever Kaylin is. I probably shouldn't say this, but we were that close. We thought we had them and didn't. So we're not going to give up. We believe we have a need for 4. We have 2. Dr. Badajo and Dr. Dyer do a great job, but they're not 4 people. They're only 2 people. So our goal is to get 4. When we get there, I can't promise that, but I'll promise you we won't give up trying. Okay? Good. Good question. Other questions? I unfortunately have been ignoring this side the whole time. So, yes. Yes. The question, I'll repeat it since we're on tape and trying to get it on microphone. Basically, the question was, where are you going to put these patients if you're going to have growth in the hospital? Is that a fair way of putting it? Yeah. And the answer, and staff, the answer is we are trying to recruit staff so that we can, and I might need Rachel here for the acronym or the name of it, but we want to open 2 South kind of as a step-down unit. And when I say 2 South, I'm talking about the rooms that are on the side of the ICU. There's 9 rooms there, I believe. Yeah. Yes, and we want to open that permanently kind of as a step-down unit. What are we calling that? The PA? PCU? Okay, and what does P stand for? Progressive Care Unit. So PCU, Progressive Care Unit. Thank you, front row here, somebody. Appreciate that. And then we'll have our overflow unit go to 2 West. So we'll open about another 8 or 9 beds over there.
Yes. Yes, open up another, hopefully 8 beds. And we have positions posted right now for permanent placement for soon to be PCU. And so we're kind of in that, how long do we wait to fill those positions? Do we need to bring in travelers to fill that, to open up 2 West? So that's kind of the discussion that actually meeting with a few leaders today to discuss, to try to finalize that plan and where we're at, so.
Because what we're trying to do is we want patients to come here, but what we're trying to do is not have them end up having to have to stay in the ER. This does not make it better. We don't get me wrong with this comment. We don't want anybody to have to stay in the ER. but we are much better off than a lot of hospitals in larger cities where they're staying in the ER for 3 or 4 days. We do not have that, but there are several days that patients stay overnight in the ER, and or we go on diversion or both. And so that's why we're trying to open up those. Basically, we're going to get about 8 to 9 additional beds if we can make this transition. But the key is not necessarily the physical space at this moment. The key is definitely finding the staff, and that's what we're working on. So good question. Thank you. Anybody else? Yes.
So I'm currently working on my doctorate of psychiatric nursing practice, and I'm
Okay.
curious what your plans are to continue expanding psychiatric care. I'd love to stay here as a provider, but I know currently we're outsourcing our care to telehealth through our primary clinics.
We do. We still have the 6th floor geriatric behavioral health unit and then the adult behavioral health unit on 3 South. So we have the inpatient side. The outpatient side, we've tried a couple different clinics. They haven't worked for us in the way that we felt that they should. We do have, our telehealth is done with providers that are employed by Baxter Health. We don't really outsource that. Is that correct, Brian? And so we do have people working internally, but they take care of patients by having patients go to their primary care office, and then we do telehealth through there. And love to chat with you sometime about how we can do things differently and or expand that area, because we know that there's definitely a need there. It's just a question of doing it in a way that meets patient need and able to handle it, I guess, the best way. So I'm glad you're pursuing that. Hopefully I would encourage any and everybody. Last year we gave out about $550,000 to future employees or current employees for scholarships to pursue their education. So I don't know if you're pursuing your education with our scholarships, but hopefully you are. And or if anybody is interested, please look into those. Okay? Anybody else? Yes.
I work in the ICU, and something that I've heard from a lot of our staff, the question that I hear asked frequently, is there any plans for maybe not a remodel, but for a refresh to clean up the look of the unit a little bit?
There is. We have tried a couple ways to go through the whole hospital and just try to keep it up to date and refreshed. ICU has definitely been on there, and we started it, but so is the OR. And those 2 units, we ended up pulling projects to get the new ORs complete and to get the ERs complete. As soon as they get done, I know I said we're going to build a new cath lab, and we are, but we are going to try to keep some resources allocated to touch-ups, for lack of a better word. The OR probably has the first priority, but then ICU is right after that, if that makes sense. Mm-hmm. Thank you. I'm glad you brought it to our attention. Yes, Chrissy.
Is pre-op and
She asked if pre-op and post-op were in that OR touch-ups, and the answer is yes. So, good. Any other questions? You guys are an easy group. Thank you. Thank you, A, for coming. Thank you for being interested in Baxter Health. And thank you so much for focusing on making sure that we are championing that access to compassionate, high-quality care. We really appreciate that. So have a great day.